paradigm for the 21st century. There's always a dominant paradigm in healthcare. In 1948, when we founded the NHS, the paradigm was free. That's all that mattered. Healthcare was free. In 1972, a man called Archer Corcoran published a book called Effectiveness and Efficiency. And that led to the effectiveness paradigm. So care had to be free and effective. Then in the 1990s, we got into cost effectiveness. And for the last 10 years, we've focused on quality and safety. Quality and safety. Is this care of high quality and safe? But there's a new paradigm, the value paradigm. Now, when a new paradigm comes in, it doesn't do away with the previous paradigms, it embraces them. So you still have to have effective, high quality, safe care. But value is the relationship of outcomes to costs. So you may have, in terms of something that's effective and of high quality, it may have some outcome, but if you get more value by giving those same resources to another group of patients, it would be of lower value. Now there's three aspects of value. One is what we call allocative value. Have we got the right distribution of money between cancer, mental health, respiratory disease, elderly people? That's allocative value. Secondly, are we using the resources well? Are we seeing the right patients? I see often in hospitals people getting intensive care, but they're not the people who need it most in the population. And then thirdly, value for the individual. A friend who's an orthopedic surgeon, a woman came to see him and said she wanted a knee replacement. He said, well, what's the problem? She said, I like gardening and I can't bend down. So I need a new knee. The GP said a knee replacement. And he said, the surgeon said, do you realize if I replace your knee, you won't be able to kneel at all? And she said, no, thank you very much. That would be of no value to me. And she went and solved her problem in some other way. So we're now moving from the era of quality and safety as the dominant paradigm to say the dominant paradigm for the next 20 years as a result of the economic crisis is value. But value is not just about money. It's about the balance of good to harm. And we'll see in the next decade concern not only about the benefits of healthcare, but the balance of benefits to harms, even when healthcare is of high quality.